Uh, I'll speak in English because there are some people who are here and they don't speak Arabic. And I don't speak French, so we'll keep it English. I hope that's okay with you. So I think we all agree that the eye area is important in contact between individuals, with eye-to-eye communication occurring in 80% in all interactions. When we are talking to each other, 80% is focusing on the eye area. This is subconsciously happening. And this orbital area conveys information on general health and impressions regarding individual health, fatigue, interest, and emotions. Sometimes when we are talking to someone, we'll have the impression that they are happy, or they are sad, or they are tired, or they didn't sleep well, only from looking to the area of the eyes. So the periorbital region is an important focus of attention in facial rejuvenation. This patient had so many problems, but the main concern she had is the periocular area, and she wanted to do something in order to improve this area. What are the problems we have in this area? We have dark circles. This is one of the most common problems we face and we receive from the patients. And dark circles can be due to pigmentation, fine lines, or veins. We have to understand what is the underlying cause of the dark circles, because it's not only pigmentation. Eyelid laxity is another concern, crow's feet, sunken eyes, and fat pads. Those are the common concerns of patients, driving them to come to our clinics to improve the situation. Causes of dark circles under the eye. There are many systemic causes. And if there is a systemic cause, whatever we do locally is going to be very limited. مش هنقدر ننجح لو في مشكلة عامة هي اللي مسببة الموضوع ده. Heredity usually is going to lead to pigmentation in the periocular area, and pigmentation is the most challenging and the most difficult problem. The other problems are much easier to deal with, but when it is pigmentation, I don't think there is a 100% effective treatment yet. If the patients are allergic or asthmatic or having eczema, this is causing post-inflammatory hyperpigmentation. So the causative agent has to be treated first. Some medications can cause pigmentation around the eye, especially medications which are causing photosensitivity, like thiazides, tetracyclines, isotretinoin. Those are ones which are associated with that. Anemia, excessive weight loss, insomnia, all those are causing dark circles. Also, increased vascularity. Increased vascularity can happen because of genetic reasons, but also sometimes it's normal vascularity, but when we are aging, the skin is losing collagen, and when the skin is losing collagen, it becomes thinner, and when it becomes thinner, it becomes transparent, يبقى شفاف, فيبين الأوعية الدموية اللي موجودة تحتيه. Fatigue, and also aging, skin laxity and shadowing. When we start to have skin aging and laxity in the skin, then the light reflection is not very good. In many cases, patients who are having dark circles, all what we need to do is to stretch the skin. If you stretch the skin, there is no pigmentation, but the light reflection is not that good. And this is the patient whom rejuvenation around the eye is going to improve the dark circles. يعني لو حد جه اشتكى من هالات سوداء وشدينا الجلد لقينا ان مفيش تصبغات في vessels او مجرد ان الجلد اتشد اللون افتح، يبقى معنى كده ان احنا لو عملنا حاجه عشان شد الجلد وتحفيز الكولاجين، او عملنا حاجه علشان استهداف الفيسلز، ساعتها الدارك سيركلز هتتحسن. If it is pigmentation, then it's not going to work by the rejuvenation. Prominent periocular veins, primarily of the lower eyelid, are a relatively frequent cosmetic problems. When they come because they don't like how it looks, not because this is a functional problem. Nothing. It is just cosmetic problem. The large reticular veins appear greenish blue in color and can be 2 to 3 millimeter in diameter. They are most often found along the cheekbone under the eye and at the temple area. زي كده. This patient contacted me by email. This was about 15 years ago. And he told me I need to come for you to treat me because I have this vein and it is a big problem in my life. I hate it. So I was going to Trieste in Italy, and I told him you can come to the course, teaching course. It was an EADV course. So he came and we treated him. Also, those veins on the temples are sometimes disturbing to the patients. So we started to treat those patients, and because many colleagues are thinking that this is something we should never do, vein and around the eye and large, this is very dangerous. So we did this study, and I did the publication in 2012 about using the Nd:YAG laser in treatment of periocular veins. So this is the patient where he has this large vein. Immediately, we are going to get immediate spasm of the vein. Here we used the 1064 with 5 millimeter spot, 30 millisecond, and 125 joules. And then 1 year later, still the remission is there. So in many cases, one session is going to be enough, but we always tell the patient 1 to 3 sessions. Always under promise and over deliver. It's much better to lower the expectations of the patient. And then also we have this large reticular vein, which sometimes we think that this is too large for the laser, but it was treated, and this was 1 month after the treatment. Here we used the 6 millimeter spot, and we used 30 milliseconds and 130 joules. Why in the upper case we used 125? Anyone can tell me why we used less fluence in this case? Because the vessel is what? Large? Smaller? Type. Larger vessels will need higher fluence or less fluence? Less fluence. So this is larger. So we used higher fluence. 130 joules. Because of the color of the skin, and this is very important. When you are treating fur skin for vascular lesions, you have to be very careful, because fur skin is transparent. The laser is going to penetrate much deeper, and we are using Nd:YAG. Nd:YAG is not selective, so it is deep in penetration. We are using high fluence. It is non-selective, so scarring is very easy to happen. So if you are treating fur skin with Nd:YAG to treat vessels, always you have to be conservative with the fluence. Use less fluence, and it's going to work. In dark skin, there is filtration by the melanin. Melanin is going to absorb, so the penetration depth is going to be a little bit less. So in dark skin, use the right fluence with very good cooling, 2 types of cooling, cold air and ice. In fur skin, use less fluence, and of course with double cooling. This is very, very important. Of course, when you are using the laser inside the orbital margin, you have to use the intraocular shield. And we are using Nd:YAG. This is not a joke. So intraocular shields are very important. There are different sizes of the ocular shields. Don't use the smallest because it's easy to insert. Use the right size for the patient so that you have full protection. لازم نستخدم المقاس المظبوط عشان يغطي العين كويس، مش نستسهل ونحط الصغيرة وخلاص. And this is a patient who had this vein also. And sometimes we have to stretch the skin to see the vein. يعني sometimes the patients are complaining of the dark circles and we don't see anything. But when we stretch the skin, we are going to see the vein. And this is what we can do with the laser in order to get rid of the vein, and we can see how much the skin becomes much more clear afterwards. And this is the same patient on the other side. She had a venous bleb. Also, it has been treated, and the vein goes away immediately. And this is another patient who hated this vein. She went to many doctors, and they said, don't touch. We can see. After one session with the same parameters, we can get rid of that. This is the patient where we need to stretch the skin in order to see the vein. The vein is not apparent when we are not stretching the skin. And we can see the erythema, immediate erythema, and the disappearance of the vessel, which happens immediately. And this is the vein on the temple, where we can use the same parameters with the Nd:YAG to get rid of that. and this is the other side of the same patient. So important precautions. We use small spot size. I cannot use 10 millimeter spot or 8 millimeter spot. Maximum 5 to 6. This is maximum. And then the laser should be directed towards the bone, not towards the eye. So if I am treating a vein, and the vein is here in the lower eyelid, the handpiece of the laser has to be towards the bone, not upwards. Yani the background has to be the bone. If I'm working on here, if there is something here, I need to pull the skin up, and then the handpiece has to be directed upwards, not towards the eye. Okay? We have to pull the skin as much as possible to be outside the orbital margin so that we are standing on the bone. Then cooling. We have to add cooling. So I'm using cold air and ice cubes. Ice cubes, I'm cooling the skin before and after the laser pulse, and the cold air is going on. This is very important in order to decrease the incidence of scarring and also decrease the incidence of bruises, because 5 to 10% of people we treat, they are going to have bruises. So we have to tell the patient that you might have bruises, and in order to avoid that or minimize the incidence, I'm using these ice cubes in order to press the area I treat for some time, maybe for 30 seconds, in order to decrease the incidence of bruises. And then we use the intraocular shield if required. Those are the precautions which we have to do with that treatment. So this was for the veins. Now we are going to be shifting to the erbium-YAG for non-ablative erbium-YAG treatment, and this is going to handle the skin laxity, tighten the skin, stimulate the collagen, and in a very safe manner, because with erbium-YAG there is no hazard on the eye. With Nd:YAG, of course, it's deep in penetration, so we cannot do it inside the orbital margin. I don't like to do that even if we did put the intraocular shield. So, but erbium-YAG cannot penetrate more than the thickness of the eyelid. So the fact is that with the erbium-YAG, if we use short pulse width and high fluence, we get ablation. But if we use subablative fluence with long pulse train, we get coagulation or heating. And this is how we can change an erbium-YAG, which is ablative laser, into non-ablative by using less fluence with very long pulse duration. And this is the smooth mode of FOTONA, where we can reach up to 60 to 63 degrees Celsius in order to achieve collagen shrinkage and tightening of the skin, and also on the longer run we are going to get new collagen formation. This is the principle by having a train of pulses in order to get a total of 250 milliseconds. Do you remember the first erbium-YAG laser in the field of dermatology? What was the pulse duration? أول erbium-YAG طلع في الدنيا كان زمن النبضة بتاعه كام؟ حد يعرف؟ كان 0.5 millisecond. It was 0.5 millisecond. And this is when we used to say that erbium-YAG is superficial, erbium-YAG is associated with rapid healing, it is not as effective as the CO2. But now, the pulse duration can go up to 250 milliseconds, not 0.5, not 1, not 10, not 20, 250 milliseconds. And this is a video where we have a piece of skin with 2 black markers. And then we are going to use the erbium-YAG with 0.5 millisecond, which is 500 milliseconds. We are going to see that the laser pulses, it's not working. It's not working. When we are using the short pulse duration, then the pulses are going to cause ablation and the lines are going to be staying as they are. But when we shift the pulse duration to 10 milliseconds, which is longer pulse duration, so there is thermal diffusion, we are going to see in the video that the lines are becoming closer to each other because of the shrinkage, because of the tightening, which happens immediately. So this is how the long pulse erbium-YAG works. Unfortunately, the video is not working. So those are the parameters we started the treatment with. We use topical anesthesia. And now we use topical anesthesia and cold air cooling. We use the non-ablative fractional. This is how I started, PS03, with 3.75 joules, 7 millimeter spot, smooth pulse, 1.7, with 2 to 3 overlapping pulses everywhere, and then 1 painting pass. And then we did 3 sessions, 4 to 6 weeks apart. This was the parameters I used for the publication I'm going to show you. Now I modified that. Now I'm using the R11 with 3.5 joules, with a little bit higher repetition rate, 3.3, which is the maximum. And then I do also 2 to 3 overlapping pulses, and then 1 painting pass, and the same. So I changed the PS03 to R11. Why? Because if we think about the periocular rejuvenation, I need to tighten the skin, and I need to stimulate the collagen. My question is, do we need to tighten the skin and stimulate the collagen on the whole surface, or only 30% of the surface? The whole. So R11 will work much better. صح? That's why I feel R11 is much better. In the original protocol of FOTONA, they recommend the PS03, but with much higher fluence, up to 7 and 8 joules. So I prefer to use less fluence, but with better coverage, more coverage of the skin, and I'm using the R11 now with a little bit higher repetition rate. This was the photos I received from FOTONA in the beginning, and I was not actually sure that this is something which can happen. So we started to do the procedure, as I mentioned, and this was, I finished the stacking, and then I'm going to be doing the painting. This was with the old protocol, the PS03 painting. Of course, we are stretching the skin. Stretching the skin is very important when you are using the laser, so that the optical penetration is much better. I don't use intraocular shield because the laser, the erbium laser, cannot penetrate beyond the thickness of the eyelid, and this is the lower eyelid. So we do the lower eyelid as well. And here I tried on one side. I said, let me see how this is going to work. So treated this side, and this was the treated side. And I didn't treat this side. Can you see the difference? Huh? It is really very obvious. I didn't believe that the erbium with that mild procedure is going to cause that. So I did on a couple of patients, and this was maintained for 1 year. So I thought there must be something which is really working well. So we started to treat our patients, and then this is what we observed. Can you see this area of the eyelid, how much is seen here and how much is seen here? And the same. Maybe it's mild, and the lower eyelids as well. Maybe it's mild, but for ladies, this is very significant because this is where the shadow is going to be shown. So if you are able to lift the eyelid a little bit, then this is a great achievement. And this was very reproducible. This patient was extremely happy. Can you see the laxity? Can you see how much of the eyelid is shown here and how much it improved? So this is something which we can get after 3 sessions with a procedure which is associated with some dryness of the skin around the eye for 4 days. So we tell the patient from the beginning, there will be dryness in the periocular area, which can be overcome by using hyaluronic acid serum. I ask them to use hyaluronic acid serum every 1 to 2 hours for 4 or 5 days, and then everyone is happy. Look at the eyelid and how much it is open afterwards. And then we did the publication about this periocular rejuvenation using the unique non-ablative long pulse erbium, and this was published in 2021. And this was one of the patients, and this was a mother of a dermatologist. So this was baseline. She was not happy with the dark circles around the eye, and this was before the 2nd session. So after 1 session, we had some improvement. And then this is before the 3rd session, 3 weeks after the 3 sessions, and then this is the baseline, and 3 weeks after the 3rd session, and this is 1 year follow-up. So it is lasting. However, we need maintenance, but we can see the difference between 2016, November, and then 2017. Is there improvement? Good improvement? Sorry? A little bit. This is not surgery. It is not surgery. And if the laxity is not apparent, then also the tightness is not going to be apparent. Let me tell you a story. 3 of my colleagues, oculoplastic surgeons, observed that when they do the oculoplastic surgery, they have a scar. And they knew that if we treat the skin, pre-treat the skin, then the incidence of scarring is going to be much less. So they told me, okay, we are going to send you the patients before the surgery so that you can do this smooth eye for them 3 times, and then after that we are going to do the surgery. So we did that. Okay, I said, okay, fine. The patients came, and we started to do the treatment, but then another problem occurred. The patients stopped going for surgery. They thought the improvement we are getting is okay. Why should I go for surgery? So my friends started to be upset. We are sending the patients to be prepared for surgery, and then they don't come back. But the fact is that if we do the surgery and pull the skin is going to be tight immediately after the surgery, but the structure of the skin does not improve. The loss of collagen has not been improved. The quality of the skin did not improve. So it is much better to work on the quality. If the tightness was significant and was enough, it's enough. If we need surgery and they go for surgery, then at least the healing and the scarring is going to be much better. So this is the concept. We are improving the structure and the function of the skin. One of the things which I just wanted to highlight, because this plasma pen was very popular 2 or 3 years ago. Although it's not a new technology, but technologies in our field are coming and going, ups and downs, because people start to use the technologies, they realize the problems, so it disappears. And when people forget, it starts to come back again. So plasma is something which is not new. It was 30 years old, and it caused a lot of problems. But couple of years ago, they came up with different names, plasmage, plexer, whatever, and even handheld devices which are claimed to be very good for periocular rejuvenation. But this is cautery. This is a cauterizing machine. So this is not selective, and it causes damage to the tissues. And this is how patients are looking after that procedure, the plasma pen. And then there is swelling. There is a lot of hyperpigmentation which happens. I saw so many patients with hyperpigmentation after that, and sometimes even scarring. It is not covering 100% of the skin. It is causing problems in the skin in many cases. Those devices are very crude. They are not as selective and as specific as the laser. So this is the plasmage. As long as we are talking about the periocular area, sometimes we see cases like around the eye where we don't know what to do. This patient was referred to me by a colleague from the US. She is a child from Tunisia, من تونس هي. So their parents came to me in Canada, and we started to do both ablation and Q-switched lasers in order to get rid of the nevus. I told them that there will be recurrence. Until now, every 6 months, we do some touch-up with the Q-switched laser, but I started with ablation because in this area, working on the eyelid is not easy because of the intraocular shield is not easy in that age, but I did the ablation with the erbium-YAG, and then I started to use the Q-switched NdYAG and KTP, and this in 11 days after the procedure. We can see the improvement, and of course the patient was very happy, and this is 3 weeks. We start to see some repigmentation, which requires further sessions. Then thalasma around the eye. erbium-YAG is one of the best modalities to get rid of the thalasma, and this is, I mean, there is nothing better than the erbium-YAG in this area. Of course, using intraocular shield in this case is very important because we are working on the eyelid and we are stacking pulses. فعلشان كده intraocular shields are very important. Finally, if you are interested in the periocular or periorbital rejuvenation, there is a textbook which was published a few years ago, and it has all the aspects of working in the periocular region. It was published by Springer. It's still available. It is covering invasive and non-invasive techniques of periorbital rejuvenation, giving or providing step-by-step guide for procedure, including neuromodulators, cosmeceuticals, periorbital rejuvenation with lasers, with fillers, with surgery, with the anatomy and everything. So if you are interested in this, this is available book. Thank you very much for your attention.